Hello, everyone. We are back live from Workvine 209. I'm Eric.
And I'm Linda. Thank you guys for joining us again today on this nice hot day in Tracy, California. We're coming live from Workvine 209, and we're a co-working facility out here in Tracy, servicing all business and community leaders and startups. And in our pivot, we're doing these live shows. And we have a great informational, you don't want to miss this, especially if you need to learn more about healthcare. She started a business on helping people. She has a passion. Oops, I'm taking your job.
It's okay. Take it away, Linda.
I'll let Eric.
She can take it away. Go right ahead. No. All right. Spectacular guest today. Founder of Williams Insurance, CEO. She does everything. She's going to add a lot of value. She's going to talk about Medicare 101. She's going to share what you need to do, how you need to get started, whatever it may be. So we're going to go ahead and bring her on. Her name is Nilo Williams. Welcome, Nilo.
Hey, Nilo.
Thank you. Hello there. I'm Nilo Williams with Williams Insurance Services. Can you hear me okay?
Yeah, yes, we can hear you fine.
Great. Well, I want to thank you, Eric and Linda, for having me on your show today. You guys are doing wonderful things in our community. Your co-working and shared office space at 209 is Workvine 209 is fantastic. It's the largest one in Central Valley. I visited a few of them over the different areas. It's a huge, beautiful 10,000 square foot office space in prime location of Tracy with lots of parking. And believe me, that's important.
Thank you. Sure. Hey, you want to interview us?
Exactly. So for those of you who need an office, I would definitely recommend this place. It has it all. You got the meeting rooms, the conference room, the private desk, lots of fun activities, and just a great atmosphere. Like I said, this is the place. I'm so excited to be working at your facility again this year, God willing. A little something about myself. I'm an insurance broker. I represent many insurance companies. My services include life insurance, retirement planning, long-term care, final expense, and health insurance. So that's a lot. When I first became an insurance agent, you basically pick your market niche. Whether it's the younger market, the millennials, the middle age, which is the working class, or the older population, which is our seniors, and I chose the latter one. I've got to say, my passion is to help educate our seniors find their way through the maze of Medicare, which is so confusing. So educating them through the Medicare process, whether they decide to work past the age of 65 or when they turn 65, to help them choose the plan that fits their needs throughout the year.
I have a question real quick for you.
Sure.
So is 65 considered senior?
65 is the Medicare age.
Okay, Medicare. But what age is senior?
Well, that's in our 80s, okay? So basically, I've been in the insurance business for 13 years now, working in San Joaquin, Stanislaus, and the surrounding counties, or wherever my referrals take me, because I love my referrals. Those are what makes our business so important. But basically, the beauty of this business is that it's always changing, especially on the healthcare aspect. Now, prior to COVID, I would have regular meetings or seminars, events at different locations to provide the educational for the basics of Medicare. And also during open enrollment, just like where I had my event set up at your location, that's our annual open enrollment in October, which is coming up. So where I would represent the different plans for the upcoming year. And believe me, these plans change on an annual basis. So they file with Medicare some plans get deleted altogether and new ones are coming in. So there's a lot of changes coming up this year. So hopefully I'll be able to reserve that multiple times at your conference rooms.
So how does someone know? So should someone have it like an advisor or somebody that they need to talk to on a regular basis to know on what's happening year by year?
It's always nice to have an agent. So this way, if you have any issues, you have to contact the agent instead of having to be on the phone with customer service or trying to do the research yourself. So when I sit down with that particular person, I basically find out the information, what their needs are, their doctor network, which is the most important thing, and then the number of medications they take. So all those play a big part in choosing the right health plan. And of course, the price is another big thing. You know, everything, it depends on their pocketbook, their budget.
Wow.
So it's an ever-changing industry. So now with the COVID situation, we have to shift to virtual meetings, which this will be tough for some folks because they don't have the technology. You know what I mean?
Yeah.
But most have a way to get online to join the meetings, to educate themselves and to choose a plan that fits their needs. So hopefully we can have small groups of people in a conference room that safety is number one thing, but at the same time, they can take a look at the plan benefits because every benefit is different than the other. So just in San Joaquin, we're looking at probably about 6 to 8 different plans coming in.
Wow.
So it's a big change. So everybody needs
a lot of homework.
Oh my gosh, yes. It started back in July, certification with every insurance company and making sure you know the benefits of everything. And like one plan, just say United Healthcare, they have about 5 different plans. So you got to know which one, like the Medicare and the Medi-Cal, combination. So everything it's something you have to consider when you're talking to somebody.
Wow.
Do you help people that are retired military? Like, is it called TRICARE? Does that interact with Medicare at all?
We do. We have a lot of veteran beneficiaries that go on to our plans as a second opinion, basically, because they love the benefits at the VA. But at the same time, like if they live in the county here, we really don't have a VA hospital. So it's nice to have a backup to be able to visit the hospitals here, because the VA, they only cover the VA hospitals. So in case of an emergency ambulance, they can go to the Tracy Hospital or the doctor's hospital, whichever one is near, because the closest hospital in the VA is the Livermore and the Palo Alto, basically.
So it'd be wise for like somebody that's a retired veteran to keep up for their secondary, because it changes, like you said. So they may have a secondary last year that is obsolete for this coming year, right?
Some plans are going to be exiting the county, so they have to shop for another one, or they'll go back to original Medicare. And I'll discuss that with you in a little bit. So like always, finding the different ways to bring the information to educate is so important. But with the COVID, and it's very scary too, to be able to go out there, go to meetings. Generally, I have large meetings too with a lot of people, but with this year, it's a little iffy. You know what I mean?
Yeah.
So usually what we're going to be doing is a lot of virtual meetings, telephone meetings, and possibly face-to-face for those that don't have the technology.
Yeah. So can you share a little bit about the difference between Medicare and Medi-Cal?
Okay, so Medicare is a federal government program for people over 65 or those that have disability that are on original Medicare. Medi-Cal basically is a state or county help, and what it is for those that have lower income. So sometimes when you're on Medi-Cal, you're full Medi-Cal or you have a share of cost. So depending on those two situations, the Medicare plans, there's different Medicare plans that get connected to it. So what it does is it kind of ties the Medicare and Medi-Cal together.
Wow.
Some of these plans are beautiful. It covers just about everything at a zero premium, depending on their level of Medi-Cal.
Wow.
So with my mom has Medicare, Medi-Cal, and she has a supplemental, Humana. So is it wise to like get all three? I thought it would be. It helps her out a lot.
Absolutely. So in your mom's situation, she has Medicare, and then she has a supplemented with a Medicare Advantage called Humana. At the same time, she probably has Medi-Cal with a share of cost. So what that means is she has to meet that share of cost every month before Medi-Cal kicks in. So the all of the share of cost, the thing. Can you guys hear me? Everything good?
Yeah, you froze up for a second there.
For a second.
Okay.
All right, we back.
Yeah, you too. Yeah. So let me share a little trivia with you. Okay. So did you know there are 10,000 baby boomers turning 65 every single day?
Wow.
Imagine that. 10,000 turning 65 a day nationwide.
Wow.
So think about the importance of the timing to enroll, to get into a plan, because everything has timelines and penalties. So if you don't enroll in a certain part at a certain time, there's hefty penalties for life. Okay, so it gets pretty ugly. So now our baby boomers are those, in case you don't know, are those that are born between the years of 1946 to 1964. So it's a big wave of seniors transitioning. So this is going to continue till the end of 2030.
Wow.
So that means 7 baby boomers turn 65 every minute.
Wow. Wow.
Every minute. So it's a big need.
Yeah.
So it's like I said, it's very important for them to get the right information at the right time, to enroll into Medicare at the right time, to avoid penalties and choose the correct plan of their choice. So a lot of times people go into the Medicare office and they think they can get their Medicare effective next month, but there's guidelines. You know, you have to enroll on this date for a 3 to 4 month waiting period for your insurance to start. So by making sure that you have a smooth transition from your employer plan to Medicare is one of the most important things. So you don't want to be without any health insurance during that time.
Wow.
Yeah. Any questions?
What do I qualify for?
Nothing.
And you're still young.
All right, cool. We good then.
Yeah, you're good. You're good.
All right.
Well, for the people that don't qualify for Medicare or Medi-Cal, there's Covered California. And do you help enroll people that don't fall into those two categories?
I sure can. Yes. And Covered California this is probably their 8th year. So they're going pretty strong. I'm very happy with Covered California because for those that don't have health insurance and, accidents happen, they're stuck with a large bill. So Covered California will be able to help them, get the medical care they need with these small copays.
Mm-hmm.
Yeah. Wow.
Or like they have a share of cost too, I think, right?
With Covered California, there's no share of cost. So really it's income and dependent based. So if your income is under the guidelines, it's automatically Medi-Cal, and then they take over. So Medi-Cal is a little behind. They're about 45 days because of the COVID and, the number of employees. So be patient if you're waiting on your Medi-Cal paperwork. Excuse me. So these are some, what's that?
This is really good information. It's preparing me for the next, in 20 years from now when I turn 65.
You're right.
care.
Boy, I cannot wait to turn 65 because the plans are just beautiful. I mean, we have such beautiful plans, and it's not going to break the bank, and it's nothing like the employer plan. Like, I'll give you an example. I met with an elderly couple, and they had their retiree plan. I'm not going to mention the county, but they were paying about $2,200 a month.
Wow.
So by the time I got them into a Medicare plan, I saved them about $1,700 a month.
Wow.
And their coverage is almost 100%.
That's really good.
Yeah. So, I mean, they scare them saying that you cannot come back to this retiree plan, but if you find a way better plan, and you won't have to go back to it. So it just depends on, getting a hold of one of the agents like myself and sitting down and finding their needs. That's a huge change. Good. And the husband thanked me, and he says, "Oh, thank you for getting my my pension back to me." So that pension was paying is almost as the pension was eaten up by his health insurance.
Yeah, health insurance is so expensive if you don't fall into any of those categories. You come out the pocket, and it is like his retirement. I mean, you have to pay for health insurance, then your living expenses, then we've been looking into life insurance, and it's good.
It's a lot. It's a lot. It's definitely a lot. So here are some common questions that people have. So when do you start thinking about enrolling in Medicare? And that's important, especially when you're working. A lot more people are working past the age of 65. So say they turn 70 and they're like, you know what, I think I'm going to retire, but I'm not sure what I'm going to do. So the timing of enrolling for your Medicare is important too. There are time frames to meet and penalties to avoid, like I was mentioning. So with all the choices you have, it's really, really confusing if you really think about it. So like things like, what is Part A, what is Part B, what's Part C, and what's Part D? And how to enroll in Parts A and B and when to enroll. Like I said, it's not an automatic thing. So so if you're working past the age of 65, like I mentioned, a lot more people are doing that nowadays. They're not sure when to enroll in A and B. And if they wait to enroll in Part B later on, there's a hefty 10% penalty.
Wow.
That goes on for the rest of their life. So it gets pretty ugly. So if you're already enrolled in Medicare plan and you're thinking about seeing what's out there available, we can help you on that too. And when to enroll and disenroll, important things like that. So
is
no
there
matter
a part R in, oh no, this guy's being funny. He said, "Is there a part R and part D?" Hey, Randy, man, you gotta cut it out.
There's only 4 parts, okay?
All right.
It's gonna get very confusing. So so no matter what your situation, like I said, we can help you with your Medicare needs. I represent all the Medicare plans except for Kaiser. Kaiser has their internal agents only, but I do offer Kaiser on the exchange, which is the Covered California side. So I would like to talk to you a little bit about the basics of Medicare for those of you, just to kind of, get the bells ringing there. So think of Part A as your hospital insurance, okay? So that covers your inpatient care, your skilled nursing facility. Those are the rehab facilities that they go in after procedure, and it covers hospice. There's no premium for Part A. You just have to work 10 years or 40 quarters to get it for free. Part B, as in boy, is your medical insurance, like your doctor's appointments, your outpatient procedures, ambulance, your durable medical. Those things are considered Part B. And the Part B has a premium. It's $144.50 per month, and that comes right out of your Social Security. And that premium is standard throughout the nation. So remember that 10% penalty I was telling you about? It's the 10% of the $144 that carries on for the rest of their life if they don't enroll in Part B in time.
Wow.
So I just want to get some clarity. So you need to enroll in when you turn 65, so that you don't get penalized? Is that
Well,
correct?
you want when you turn 65, you want to enroll in Part A at least. Okay. And if you're still working, then you have your employer coverage. So it doesn't make sense to enroll in Part B because there's a premium. So if you still have your employer coverage, stay with your employer coverage, but still have your Part A. But once you're getting ready to retire, then you want to make sure that they coincide with your effective date of Part B and your last day of your employer, because you don't want a gap in insurance.
Gotcha. Wow.
Okay.
This is good information.
Thank you. And then we're going to talk about Part D. D is in dog, and that one is for the drug coverage. Okay. So this can be added on as a standalone drug plan, or you can add it on as an all-in-one bundle. And then finally, Part C is the Medicare Advantage. I don't know if you guys seen the Joan Namath commercials. I get so many calls from my members. It's that all-in-one commercial. He talks about, oh, if you don't have the all-in-one, it gives you this, this, and this. But Medicare Advantage is great for those that have the medical networks associated with it. What it is it covers Part A, B, and D all in one, with a very low premium. It gives you, a lot of them gives you dental, vision, transportation, all these benefits at no cost. So it's something that a lot of people look for. Those are the ones that change on an annual basis. Like some plans will exit the county, new ones will come in. So it's very important to check that on an annual basis. So there's time frames to meet, the penalties. We're talking about all that. And then Part B premium is the same for the whole nation.
I'm not sure if you okay. Freezing up just a little bit again.
Now, if you don't have, we're supposed to, there's penalty. Okay, here we go.
There we go. You got you back.
So good. So Part D also has a hefty penalty too. That's for the drug plan. So when you're on Medicare, you need a Part D to cover your prescriptions. Okay. So when you don't have a Part D, that means you're paying full price for those medications. And some of those medications are expensive, especially the inhalers or the insulin. Those are very expensive. So the Part D for the drug plan allows you to pay co-payments to get your medications. But if you don't have the Part D, there's a 1% penalty for life on that one too.
Wow.
So they make it tough, and you got to stay on top of that. Now,
I have a question.
Sure.
If you have supplemental insurance along with your Medicare and maybe Medi-Cal, then your supplemental will pick up the Part D, or how does that work?
Well, it depends on what type of supplemental you're talking about. So we have one supplemental that's a Medicare Advantage, and that's the one that's a Part C. Okay. So that one has everything built in it with a copay. The other supplemental is the one that we call a Medigap. It's called a Medicare supplement, like United Healthcare, AARP. There's a whole bunch of insurance companies, and those have the letter plans. They have A through N, depending on what your budget is and what your needs are. And what that does is basically it covers the gaps that original Medicare doesn't cover. So if you're on original Medicare, you have the A and the B alone. If you get sick, you're going to have some big bills, because Medicare only covers 80%, and then the 20% is your responsibility. So imagine, God forbid, if you went to the hospital with a heart attack, you're looking at least $100,000 bill. So your part is going to be 20%. So
wow.
Yeah, and there's no maximum. There's no cap on original Medicare. So it could be more than $20,000. So
wow.
what they do is Medicare supplements. They help cover these gaps. Like there's a G Extra that's coming out. G Extra basically covers everything 100% once you pay $198 deductible. They have vision and they have hearing aid included in it, which is good because Medicare supplements never really had those in the past. So they're being more innovative with the things that are needed for our seniors. So we talked about Medicare Advantage. The Medicare Advantage is offered by insurance companies, but they're approved by Medicare. So we won't know the exact benefits till October 1st. And that's when we know all the co-payments, the premiums, the medical networks associated with it. So right now, everything's kind of in the works. And my members call me, hey, Nilo, what's going on? I said, I can't talk to you until October 1st. So that's the hard part, because you have to wait till the plans are approved by Medicare before we can actually talk to anybody about it.
So if you turn 65, after the enrolling period, do you need to wait a full year until the next enrollment period, or do you apply like when you're 64, right? How does that work?
Very good question. So when somebody turns 65, they have their own open enrollment time. So they have a 7-month window to find something: 3 months before their birthday, the month of their birthday, and 3 months after. Okay. So they can get into a plan and shop around and make sure that it's effective the first day of their effective Medicare date. So they have their own enrollment time. And then once they're on that plan, then they generally come on to the Medicare open enrollment every year, which is in October.
When does open enrollment end?
Good question. That was my next segment. Okay. So, open enrollment is called the annual election period. It starts October 15th and it ends December 7th. So I have some members that come to my meetings because I represent all the plans. And they come to my meetings, they look at the benefits, they probably put an application, they'll come to my other event, they'll put an application. So the last application that they choose is the one that's accepted by Medicare. So they can put in 20 applications if they want. The last one will stick. And that will be the one effective January 1st. And then they came up with another election period, which is fantastic. They started this about 2 years ago. So say a member got into a plan and the last day of enrollment was December 7th. So they get their plan benefits in January. They realize, oh my gosh, my doctor's not in it. So Medicare's opened up a open enrollment period from January 1st to March 31st, where they can change one time to another plan. So this is so important because you don't want to be stuck in a plan for a whole year and you can't see your doctor. So I love that new feature that they came up with. And then also there's special elections for people that are moving or if they go into the hospital or nursing homes. They have a change, a one-time change that they can make.
Wow.
So it's a lot of information.
Yeah, it is.
It is. So do you see your clients every year?
I generally speak with them multiple times a year, but the most important time is once a year when they come see me. We review everything and we see if there's another plan or if they just want to carry on the plan that's still existing.
I really love this because thankfully I have, my mom, I take care of all her Medicare, Medi-Cal, all that stuff. So we, my age group, we have aging parents that, need this type of, and I'm totally not a pro at any of this. I'm like, I have to make multiple phone calls, and Eric will tell you, I'm like dealing with, Medicare, Medi-Cal all the time for her.
Call me.
Yeah. So I think it, how can people get a hold of you? What is the best way?
Well, you can reach me on my website, email, or my phone. And like I was mentioning, I'm starting to have weekly Zooms on Wednesdays at 10 o'clock, and I'll be covering the basics of Medicare. It's about 30 to 45 minutes. I'll have that every Wednesday at 10 o'clock. to make sure that we can get this information out to as many people as possible.
Yeah. I'm going to put that in the chat too. So it's a Zoom call every Wednesday. You got the Zoom ID and the password. So if you, you got it up on the screen too. Here we go. Yeah, and it's in
Yes, thank you. Yes. So I've set up virtual seminars to help people understand the basics of Medicare, which is so important. Like, here's one thing. So a lot of people, they get so excited, they have their Medicare A and B, and then they go and enroll in a drug plan, okay, the Part D. So that takes away their election period to get into a plan like a Medicare Advantage. So there's restrictions on all of that. So having the knowledge to pick the right plan at the beginning avoids all the delays later on. Yeah. So I don't know if you caught that one, but it makes a lot of sense to find out what's available for you before you enroll in something. And it could just be a simple, understanding of Medicare. And the other thing too is I'll be at the Tracy Walmart again this year during open enrollment, and we have a booth set up. It's called Healthcare Begins Here, and we represent a lot of the plans there, and I'm generally by the pharmacy. And we're going to be doing that October through December, and we do that every year because Walmart promotes a lot of the carriers there. So basically what we like to do is we like to help you eliminate the anxiety of the Medicare maze, which can be very, very confusing.
And even if you're not 65, I don't think I'll be 65 for another 20 years. But, for those of you who are young or like us, you can think about this even for your parents, because maybe they don't know what to do, or maybe you're taking care of them and they're getting of that age where they need to apply for something. So they, even, the kids can reach out to you to find out a little bit more so that they can support and make sure that their parents are aware of these rules and guidelines and the benefits that you can offer them.
And you'll be coming back to Workvine 209 too. Please use our facility to be with your clients if they don't feel comfortable with.
Absolutely.
Definitely.
Yep. And I'm excited to be back there again this year.
Yes, I can't wait. We'll announce that date on our website of when you'll be here to talk about health insurance or to get people enrolled. And of course, we'll do the social distancing stuff and, be COVID compliant. Don't worry. And we sanitize. It's a very safe place to be.
Yes.
I wanted to add one thing is nowadays a lot more folks are living in the sandwich generation. Do you guys know what that is?
In the what generation?
Sandwich generation.
Sandwich.
So basically, we're taking care of our kids, we're working, and we're taking care of our parents. So they call it the sandwich generation. So a lot of the parents haven't really thought about the retirement of what they're going to do, their long-term care or anything. So they rely on their children to be able to, take care of them, which is important. So really, it's our duty to understand and take care of our parents. I mean, after all, we wouldn't be here if it wasn't for our parents.
Yes.
So my youngest client is 34 and my oldest client is 98. So that kind of gives you the age ratios of Medicare. I mean, Medicare can be any age depending on your disability.
Wow.
And you could help with Covered California too. And that's, any age after 18. Is that right? Or yeah.
Absolutely. Yep. So,
wow. Really valuable information.
Thank you. I know it's a lot of information, but it's good to know this information because we're going to need it one day.
Absolutely. Any last words that you'd like to leave with our viewers?
Well, I want to thank you so much for your time. Please be safe and be well, and I hope to meet you in the future and answer any of your Medicare questions.
Yeah, so reach out to Nilo. Her information, her email, her website is all in the chat, even her contact number. She has a phone number, so if you have questions, reach out to her. No questions is dumb questions. Just ask, right? Get the answer. So,
thank you. Is there any questions we need to answer?
We are good. I think we're good.
Well,
Other than that, part
Eric.
B, part R.
We'll make a special part for you.
Yeah.
We'll make it part E for Eric.
Yes. Well, thank you, Nilo, for being a part of
our show. Stay well, be blessed, and I'll see you guys soon.
We'll see
Thank you. Thank you for all that valuable information. We'll see you back on Tuesdays and Thursdays. Actually, this Thursday and next Tuesday, we won't be here because it's a holiday coming up. And so we decided to give everybody a break and ourselves. So
hey, you deserve it.
Yeah.